Well, they put their lives on the line for this country and thought they could turn to the VA for medical care after they left the service.
But veterans say after leaving the front lines, they're now having to fight for their lives back here at home. Earlier this year, after it came to light that veterans were facing long waits to see a doctor, the VA's top brass promised to make it easier for vets to get treatment. But News Channel 5 Investigates reporter Jennifer Krause found veterans who say it's not getting any better.
Dallas Brown served on the front lines in both Iraq and Afghanistan.
I was with Delta 175 Cav.
Melvin Oliver joined the Army shortly after the end of the Vietnam War.
I was in the Alpha of 2nd 320th Field Artillery.
But despite their service, both men say the troubled VA health system has let them down, and even worse, put their lives in danger. Oliver says annual x-rays several years ago showed shading on one of his lungs. He says his doctors, though, told him it was nothing to worry about. But then earlier this year, Oliver began suffering dizziness, unbearable headaches. He regularly lost his balance, and his nose just wouldn't stop running.
It was just like water. It was just like a faucet.
Doctors at both the VA clinic near his home in Hopkinsville and the VA hospital in Nashville told him he had sinusitis and prescribed antibiotics and antihistamines. But Linda Jones says her brother's health went from bad to worse.
I said, Melvin, you don't have sinusitis. I said, something bad is wrong with you. And I said, and VA is not the one you need to get to diagnose you.
Jones finally convinced Oliver to go outside the VA system to Jenny Stewart Medical Center in Hopkinsville, where doctors told him it wasn't sinusitis making him so sick, it was a brain tumor.
Well, needless to say, I was floored and, just in shock, I suppose, just kind of hit you like a ton of bricks.
And then his new doctors delivered another bombshell. That shading in his lung was really another tumor, and that cancer had then spread to his brain.
I think they didn't do their job. I think they should have done further testing.
Since his brain surgery, Oliver has continued to have vision problems. Yet the VA says it will be 4 months before he can get an appointment.
They have done him so wrong. So wrong. And I'm sure he's not the only one.
Are they doing enough to help your husband?
No.
Kim Brown says her husband is another example of what's wrong with the VA healthcare system. Dallas Brown suffered a traumatic brain injury and multiple broken bones while fighting in Afghanistan, which led to a medical discharge last year. But getting medical care for him from the VA, Kim says, has been one challenge after another.
They in turn had to cancel 2 of his doctor's appointments because there was no doctor.
The VA, she says, made her husband wait 5 months to see a doctor after he essentially stopped urinating.
By the time we finally got into them, they tell me, oh, well, your left kidney's dead. We're not going to worry about it, and just come back in 6 months and we'll see how you're doing.
But the Browns say Dallas began gaining weight, suffering extreme dizziness, loss of balance, and nausea, while his blood pressure rose significantly.
And I told him I wanted something done. I said, y'all have ran no tests. You have done nothing to figure out why he cannot go to the bathroom.
The doctor, she says, agreed.
He said, yeah, we need to do a bladder scan ASAP. They scheduled it for December.
So 9 months?
Yeah.
You have to wait 9 months for this test that you need ASAP?
Yes.
While the VA recently promised to make it easier for veterans to get care outside the VA, for the Browns, it has not been easy.
His primary doctor and myself have had to call Vanderbilt 3 times to try and get an appointment because the VA has not sent over the paperwork.
For Brown, fighting on the front lines in the war on terror was tough. But in his struggle to get medical care, he says, the VA is proving to be even tougher.
Honestly, I think I'm afraid. I'm afraid I'll end up having a stroke.
And in this battle, his wife says, even she is afraid he may not win.
I almost lost him in Afghanistan, and now I'm going to lose him because of the VA.
This afternoon, the VA sent us a statement saying, quote, we take these matters just as seriously and determine what we can do to appropriately and accurately provide care, not only for Mr. Brown and Mr. Oliver, but for every veteran that reaches out to us. These concerns will not go unnoticed or unaddressed. I understand their frustration, and as a veteran myself, I want only the best for my fellow veterans. We continue to work tirelessly to address the issues of access and accelerate care as quickly and as clinically appropriate as possible.
This has to be so frustrating. How are the men doing now?
Well, Vicki, Melvin Oliver is undergoing chemo and radiation and trying to remain optimistic through all this, while Dallas Brown wound up in the hospital for several days shortly after our interview after his kidney levels spiked. He is back home now, but his wife tells me that even while he was in the hospital, the VA still didn't run that bladder scan that his doctor said back in March was needed ASAP to help determine what's wrong.